In order to understand the hospital-acquired conditions and the present on admission indicator concept, let's have a quick overview of Medicare's payment methodology for acute inpatient admissions. Currently, Medicare is using the IPPS, or Inpatient Prospective Payment System, to cover facility charges for acute inpatient episodes of care. The advantage of this system compared to the previous one is that Medicare knows in advance how much they will have to pay for any given admission. In the past, it was very different. Hospitals were paid based on the charges billed. There was no incentive on the hospital's part to cut spending because the more they billed, the more money the government sent them. In order to prevent this from happening, Medicare adopted this different system that is based on MSDRGs, or Medicare Severity Diagnosis Related Groups. Under this methodology, diagnosis codes and inpatient procedures are grouped into DRGs, or Diagnosis Related Groups, and have a price tag appended to them based on how intensely they are expected to consume the facility's resources. Please note that payment is based on expected and not actual resource use, meaning that Medicare will always pay the same amount for a given DRG regardless of the facility's actual expense. If the hospital spends more on a beneficiary than the Medicare allowance, there is no further reimbursement from the government and they cannot charge the patient either, so they will most probably lose on the case. On the other hand, if the hospital is able to treat the patient for less than the Medicare payment, they can keep the difference and make a profit. You can see that this system is incentivizing hospitals much more than the cost-based reimbursement in the past. Now, how does Medicare know exactly which DRG a patient should belong to? Well, they use an incredibly complex logical system that is actually so convoluted and has so many elements to it that nowadays it's handled by software to make it easier on us. This software is called the DRG Grouper. The grouper analyzes attributes of every given case, such as the principal diagnosis, the secondary diagnoses, any procedures if they were performed, and for some DRGs, also the age, the sex, and discharge disposition of the patient. The more severe a case is, the better it will pay.